The Paula Show is on. The Paula Show. Come on, one and all. I extend an invitation to the Paula Show. Join in the conversation. Transforming behavior, recognizing our Savior, overcoming hurdles, achieving dreams. Together we can succeed.
Victoria lives hundreds of miles away from the nearest full-service hospital. Although she feels lumps in her breasts when she undertakes her self-examination, she's reluctant to spend their limited financial resources on a doctor's visit. She decided to wait until the children are home on school's vacation so that she could visit the doctor and it would be less stressful for the family. When she arrived at the doctor 6 months later, she was told that if she had arrived only a few months before, they could have done much more for her. Victoria's story is common. Sometimes people are not able to visit the doctor even when ill because they just don't have the money. Tonight we'll be speaking about Theolinda Charles, and she'll be sharing her story with us about breast cancer and how she's surviving. Thank you for staying with us on The Paula Show. We'll be right back after this commercial break. Stay with us, please. Thank you for staying with us on The Paula Show. Remember to watch The Paula Show via CTV Channel 2 on Tuesday nights at 9, and Sundays there's a rebroadcast at 1 in the afternoon. The Paula Show inspires, entertains, and transforms behavior. Like me as well on Facebook, The Paula Show, and watch The Paula Show programs via YouTube at The Paula Show TV. Theolinda Charles, a breast cancer survivor, is here with us tonight, and she'll be taking us on a journey from the moment when she realized that she was diagnosed with breast cancer, the surgery, and her future aspirations. Good evening, Theolinda Charles.
Good
Welcome
evening,
to the Paula
Paula.
Show.
Thank you very much, and thank you for having me.
Certainly, you're a breast cancer survivor.
Yes, 1 year, and I would say 1 year and what, 1 month?
1 year and 1 month?
1 year and 1 month.
And your right breast was removed.
Yes.
How are you feeling today?
I must say I'm feeling very blessed, and most of all, I thank God for surviving.
All right. There are about 1.38 million new cases and 458,000 deaths from breast cancer each year, and this is from the WHO. This is globally. Breast cancer is by far the most common cancer in women worldwide. I'm sure you're aware of that.
Yes.
Upon reaching age 40, your mammograms were scheduled for every 3 years.
Every 3 years. Which I actually forced my doctor and said, okay, I'm 40 now, so let's put on the paper mammogram time. And he says, who is the doctor? And I said, well, I've been to many funerals, and they weren't 40 yet, and they were dying of breast cancer. So now I am 40, 3rd of January, so let's schedule. So he says,
every year instead of every 3 years.
I'm going to send you every 3 years. Don't bother me to send you earlier because it's every 3 years. So on my 40th birthday, I had my first mammogram. I hated it. I said to him, I don't want to do any more. He said, okay, every 3 years. So I made up my mind every 3 years.
I don't mind the doctor advising me what to do, but I think at the end of the day, it's my body, and I believe I know what's best for me. Lately, I've been told mammograms annually, pap smears every 2 years. I don't like surprises, so I insist around my birth date, March, we're doing the mammogram and we're doing the pap smear.
Same with me. When January 3rd comes around, I'm not doing anything but schedule my doctor's appointment And I would say, we're doing pap smear, we're doing mammogram, we're doing AIDS test, and I come down the line. He said, okay, okay.
And you would agree that your results
Yep.
for your mammogram were fine
They
until
were fine
2016.
up until 2016. I remember I was actually at a family reunion meeting when I got the call, and I excused myself. And he says he just got back the mammogram result and he didn't like it. So I said, is it bad? He said, so I said to him that I will call him back later because I was at a
And
family.
this is your primary care physician?
This was my primary care physician.
Expressing his concern at the
his
results of your
concern,
mammogram
and,
in 2016.
You know, I think the following day I went in to see him, and you know, we discussed about changing of my diet, certain things that he want me to cut down on, cut out and stuff. And I started, but you know, sometimes you
become a little bit delinquent.
Right, and you know, I be honest, and I tried my best. I increased my vegetables more and stuff like that. And because I go to him only once a year, you know, and then he said to me that he was going to schedule me to do an ultrasound. So I said, okay, no problem. So
this
when
is still 2016.
This was 2016. That was the first time I did the ultrasound.
Yes.
So I went and did the ultrasound. So I said to him, you know what? I prefer the ultrasound than the mammogram. So could we skip the mammogram and just do the ultrasound?
I don't think so.
He said, nope,
you have
can't
to do both.
it. So from then, rather than doing the mammogram every 3 years, I was doing the mammogram every year and the ultrasound
annually.
every year.
Generally, doctors inquire about your family history.
Yes.
In order to make assessments about your risk towards certain diseases. Would you agree that your family has a high risk of cancer?
Yes, on both sides, on both my mother's side and both my father's side. I have a lot on mommy's side, where it's like cousins, fourth and third cousins who are breast cancer survivor, and I think maybe one or two may have died. When I checked with my father's side of family, not that much, but
more
still
side.
because the cancer was more different cancers,
cervical,
were
prostate,
cervical, ovarian was, you know, he then said, well, we have to watch and see.
Yes.
You know?
And I think that's why he was so concerned.
And one thing I must say, he was on top of me from that time. He was on top of me. And I remembered when the mammograms were coming, and he says, I don't like these mammograms.
2017, he was still concerned.
2018, he was on me like rice. He was like, I see you not changing your diet now because I see the weight coming on.
Exercise.
You're not exercising.
Did you get special medication?
Nope, never was put on any sort of medication.
But when we say that the doctor was concerned, we have to make it absolutely clear to our audience that the doctor saw increases in fatty tissue in your breast.
So
and that's
certain
what
foods
caused him concern.
He was telling me to cut down on. Gradually cut down and then cut out. And I tried my best. And I honestly, you know, because doctors, you can't fool them, you can't lie to them, you know. And he says, I don't want to be blamed for anything. And I used to say to him, do not worry. I am going to be taking care of myself. So I'm going to do everything that you said. So, you know, I would see the ice cream and the chocolate, and I said, okay, let me keep away from that. I used to see the Coke. I said, okay, no. And even sometimes my co-workers, because I never really hid anything from my co-workers, and they will say, you're not supposed to be eating that, you know, you're not supposed to be eating that, you know, and even
accountability.
I could count on my fingers the co-workers who were looking at me and let me see what you're eating there and stuff like that. Because, you know, sometimes I would cheat, you know. And
I imagine your friends and your family
friends
were equally
and families,
supportive.
you know. And I decided, okay, and everybody was saying, you're putting on so much weight and stuff like that. And I said, but I always, like when medical benefits is having their walks, I will take part. breast friends is having their walk, anybody having their walk, I was always taking part. And then I started myself walking in my neighborhood, going to the beach, doing my exercise. I'm not a swimmer, but I love go to the beach. And when I'm in the water, I have my noodles and I'm swimming and I'm exercising.
I guess you're beginning to recognize that this is a serious situation.
This is serious, serious, serious. And then when 2019 came now.
Well, let's talk about 2019 in the upcoming segment, because I believe that in 2019 you want to tell us about your breast cancer diagnosis.
Yes.
Thank you for staying with us on the Paula Show. Theolinda Charles, a breast cancer survivor, has joined us in studio tonight to talk to us about her journey. We'll be right back after this commercial break. Thank you for staying with us on the Paula Show. As you might be aware, October is Breast Cancer Awareness Month. And we are particularly undertaking this program tonight because we need ladies to understand you're an integral part of your family unit, of your community, of this nation, and you must schedule your mammogram each year. And although we're not talking about the pap smear tonight, I would say schedule the mammogram and the pap smear together. Consider them identical twins. Get it done, ladies. We don't want the statistics of breast cancer to increase in Antigua and Barbuda and across the globe. Theolinda Charles, a breast cancer survivor, is here with us. You were about to tell us in 2019 you did the mammogram and the ultrasound.
Yes.
Okay.
Did the mammogram, and on doing the mammogram in January, my physician called me, not with good news. He says, I need you to go and do an ultrasound right away. This was, I think, maybe the later part of January into February. And I said, okay, no problem. I already scheduled it, but it's scheduled for April. He said, Miss...
And this would be at the hospital?
Yes. Okay. He said, Miss, I cannot wait that long. I said, well, I'm so sorry. I can't do it immediately because I don't have the funds. He says, well...
The funds to do it at a private facility.
To do it at a private facility. I then asked him how much it costs and everything. He said it's roughly around 300. I said, okay, I'll see. He said, but you first need to come to the office and collect the paper. I said, okay, no problem. I gave him the assurance that I would come, but...
This is the latter part of January.
This is the latter part of January.
You got the documents?
Going to February, still did not go. Going into March, still did not go. And then I think...
And this is because you didn't have the money.
Have the funds. And, you know, with your pride, you don't want to really go and ask nobody. I could have, you know, got assisted because I have good family and friends, but I said, I just pray to God. I said, Lord, you know, you're going to help me. You're going to see me through. I'm going to do this ultrasound, and whether it comes back positive or negative, you're going to be with me. And went and got the papers. He wasn't too happy because he knew that I waited that long to go and get the papers. Went and got the papers, went and did the ultrasound, and as I was doing the ultrasound, the technician, you know, would have been speaking with me and explaining to me certain things and things like that. So I sort of kind of had an idea because the technician was communicating with me as well. And still, you know, still trying to be this tough cookie. And then it was, I think, it might have been the early part of May or second week in May when I did call the physician.
1 moment. I suppose that after you completed the ultrasound,
yes,
that your emotions were going wild.
Well,
because you're waiting now for the results. Waiting is difficult.
I think during the waiting period, it was like I was least concerned that much.
You weren't overly worried?
I was overly worried.
Okay.
I wasn't overly worried, you know. I said, I think I had geared up myself that whatever it is going to be, I know I was going to have the support.
We had the WhatsApp now. You received the WhatsApp.
So when I received the WhatsApp, I remember I was at the time working down at the landfill, and I was on the 10 to 6 shift. And I said, let me check my phone. And I checked it, and he said, I remember the specific words was, Theolinda, you need to come into my office to collect the form. There was a lump found in the left breast.
Oh dear. And
I screamed out, and I said, I called my coworker. She was a cleaner at the time, and I said, LaShawn, come here. I have cancer. She said, give me the phone, let me see. Just like that.
Just like that?
Just like that. And she said, give me the phone, let me read it.
You were crying?
And I wasn't, I don't.
You screamed initially?
I screamed initially. I can't
but
remember.
But after that initial shock,
I can't.
You probably settled down, you think?
I can't remember if I had cried.
Okay,
or if I did, it wasn't really
weeping.
No weeping. And she said, give me the phone. And she read it. And she said, I don't see the man said nothing here that say cancer now. I said,
the lump in the breast.
I said, lump in the breast? Okay. So I think the following day I went to his office, got the form, went up to the hospital, make the appointment, and went for the appointment. I remember calling my brother. He's my rock, my baby brother.
Were you self-examining your breast?
I did, but I never felt anything different. And I felt both of them. I did everything I used to.
Because generally, my OBGYN, he shares information with me by way of printed material on the steps that one should undertake in order to conduct the examination.
I actually have the stuff stick up right by my shower.
Because I was doing it incorrectly. I had my arm outstretched at the back and doing the touching, and it's not supposed to be done like that. So I was doing it incorrectly at a particular point until I understood that it had to be done another way. So I'm wondering if maybe you were not doing it right.
I was doing it right because I had this stuff stuck right by the shower. I was watching it every time.
So you're satisfied that you did your best?
You know, I did my best, but I guess I probably didn't know what to
Or maybe sometimes,
you know,
sometimes the lumps are just a few centimeters.
At one time, I just said, wait, my breast and them look extra heavy or something, you know.
Yes.
But because I never felt no sort of
abnormality,
you know, I just...
We might miss small lumps. However, the machines will be able to identify them, because sometimes too, one lady's breast might be very dense compared to another lady's breast that is not as dense.
I used to say to him, you know, can't we just bypass the mammogram, because the ultrasound, you lay down and you're laughing and everything, and you watch, because you see everything on the ultrasound.
Yes.
You know, you're able to communicate more and everything.
Because it's more comfortable.
And it's more comfortable, the mammogram.
But we don't want to discourage anybody.
No, I would not say.
Scheduling that annual mammogram.
I always say it's uncomfortable, but yes, you have to do.
It's uncomfortable, but it's a must.
It's a must.
I noticed you gave me this pink pin, and I was saying to you, it's clashing with my...
No, it looks just fine.
Yes, this pink...
And I want you to wear it for the whole month of October. You're going to church, you have it on. You're going to work, you have it on.
What's the symbol for this?
It's breast cancer awareness. That's our color, pink.
But do you only wear it in October? Because I think breast cancer is affecting so many women globally. We need this reminder every day of our lives.
Well, for me, now that I am actually a survivor, I wear it all the time. I wear it all the time.
We're on our way now to Mount St. John?
Yes.
And another physician.
Yes.
You have the documents from your primary care physician. And we keep saying primary care physician. Dr. Dane Abbott, our OBGYN.
Oh, the best, the best.
He's
Oh,
my
yes.
genius, my superhero. You're at the hospital now, and you presented the documents to another physician. And upon doing so and the examination, she revealed to you that she found additional lumps.
Well, in meeting her that day, she already would have known what I was coming for.
It's about the left breast.
It's about showed her, well, she would have got the paper from my primary care doctor, what was found in the ultrasound.
For the left breast?
For the left breast.
Yes.
And she said to me, what she's going to do, she's going to check the left, but she's also going to check the right. So I said to her, so I said, I have no problem. You're the captain right now, I'm the passenger. So they did their checks, and she said, in the right I'm feeling more stuff in the right than the left.
Oh, no.
So I said, okay, no problem, let's focus on the right. She did feel in the left, and she said, yes.
And she confirmed what the results.
She said, yes, she's feeling something in the left, of course, and
so the results were accurate, but then no, she's examining the right, and she's expressing concern.
Right, and her assistant as well did the same thing, and so I said, okay. So she said to me, okay, we can do something we call needle localization, and to do the biopsy, and she explained to me how it's done. You insert the needle into the breast. We scheduled to have that done. And the morning of that, I went in, I think it was sometime in June. I can't remember the exact date, but it was sometime in June. We did the biopsy, and she herself wheeled me into the area where they were going to do it.
Surgery.
And I met a very nice doctor. I always said to him, he's going to be one of the best doctors, Dr. Goodwin. I know he won't mind me.
The radiologist.
Oh, he is the best. He is the best.
He's my friend.
Oh, my Dr. Goodwin. He's
my friend.
The best.
He's my friend.
And I went in, and Dr. St. Luke. Oh, she is super. Oh, she went in with me, Dr. Serena St. Luke's. I know she won't mind, because I already told her I'm not going to stop mentioning your name. And she went in with me, and I was alert.
So they did the procedure.
Yeah, the biopsy is something that you don't have to stay in the hospital, but you just can't drive afterwards.
Okay, because you might aggravate the area.
Right.
And you received the results how soon after?
I think the result was done in less than a month, I would say.
And what did
less than a month. She said to me she collected them the weekend, but she wanted me to have a good weekend, and because she knew I was coming to her the Tuesday, she'll wait until then.
So you went on the Tuesday.
So I went on the Tuesday, and I think it might have been around after. I think I had either 10 or 11 o'clock appointment, and I went in. I didn't have anybody accompany me at that time. I went in, and she said, I don't have any good news, but so I tell her, bring it on, let me know what's going on. And she says, we found that it's cancerous, it's in the early stage. And
stage 1, 2?
At that time, they couldn't say what stage it was, early stage. So I said, okay, no problem.
But they did a biopsy on the left as well?
Did a biopsy on the left.
So the left
afterwards.
afterwards.
So I said to her, okay, let's schedule for surgery. And she says,
right there and then you
right
said
there and
that?
then I made the decision.
But you didn't even wait to hear all the options.
I said to her, let's take it off. I made the decision right there.
It didn't seem as if that was a difficult decision for
Nope.
you to make. But generally, we ladies, we love our breasts.
I love my life.
Oh.
I love my life. I was crying, of course. She said, okay, I'm going to leave it for a few minutes, no problem.
It's amazing, though, that this all started out with your left breast. One would expect the doctor to be telling you your left breast will be removed. But the doctor is now talking about your right breast will be removed. Well, you made that decision.
I made that decision.
And you're not even sure as yet whether your left breast will have to be removed as well.
Well, I then did say to her, let's do the biopsy on the left.
Okay.
And if it came back that it was positive as well, we're going to remove both. Because I love my life and I want to live.
So you want to do a double mastectomy?
Yep. And she said to me, let's wait and see the result of the left breast. So we did the biopsy on the left breast.
Okay.
But in the meantime, I already told her, let's schedule.
So the right, you've already made that decision.
Yes.
The left is pending.
So the left is pending. So I think I did the biopsy maybe less than a month after on the left.
And what were the results?
And she was able to call me on my phone. And she said, Theolinda, I have good news for you.
Yay!
Everything is good with the left. And I was at work and I said, oh, thank you,
no
Jesus.
need to scream this time.
I was screaming at work.
You were screaming.
I was screaming. I was in the office.
With optimism.
And, you know, I told my co-workers and because people say, oh, they hide. I don't hide anything because we are ladies and you want persons to know that in things like these, you don't have to go and lock yourself away.
I find that when one is open about illness, it causes other people to approach you and to feel comfortable offering advice. And even like you say, offering you food that might help you through a particular situation. But if you lock yourself away and you don't want to be, let's say, bothered by other people, then you're looking at possible depression.
Yeah, you can go into depression and you could lose your life.
Sometimes people become suicidal.
Yep.
And then you're not helpful to other people who might be experiencing the same malady and would like to team up with you and you know, both of you can go through it together.
And, you know, you had persons who told me, okay, no, you have to stop eating this and you have to stop eating that, you know, and what the doctor said to me, I think the same time when I was given the news about the diagnosis, that's when I met the oncologist as well. And he went through the consultation where he says, how are you feeling mentally, spiritually,
those are important
socially?
questions.
He says, I want to know how you're feeling. Tell me, okay, I'm going to sit and listen to what you have to say. Because you're the one, it's your life, it's your body. You have to tell us what you want.
Because unless they know exactly how you're feeling, then they may not be able to help you appropriately.
Right. And he, you know, he spoke with me. He told me what's the best result to do and everything. And I said to him, I already made up my mind. I am mentally ready. I'm physically ready. I'm socially ready. I says, I already done tell half of the world, so I have nothing to hide.
Listen, we are thankful for your openness, and coming up in the next segment, let's talk a little bit about the day of the surgery and follow. Thank you for staying with us on the Paula Show. Now we're going to hear from Theolinda about the day of the surgery and following. What happened?
I drove myself to my friend's house. And then she then drove me to the hospital where I met my family members and friends. We hugged, we prayed, and the time came up for me to go in, change off into my robe, gave them everything, and we
surgery started.
Surgery started. Well, yeah, surgery started.
Well, after all the preliminaries.
Yeah, all the different preliminaries. And everybody was saying, wait, you really know you said you're going to do? And I said, yes.
Because you were all excited and animated.
Yes, and you know.
Okay, so surgery happened. The right breast was removed. No need to touch the left one.
Nope.
The right breast was removed. Well, actually, right. And you're up.
I remember when I was finally awoke, I was screaming, I was crying. I said, nurse, I need some more medication. She said, not yet, not yet. It was pain, it was pain. And then I remember looked around and I saw the physician pass and I said, can I get some more medication? She said, no, Theolinda, you can't get any.
Probably got the maximum for the day.
We gave it a maximum so far. You're going to be all right, no problem. And I remember they wheeled me to my room and my brother was there making certain my pillow was set and everything is fine.
That's a special brother.
Oh, I'm telling you.
Yeah, you were hospitalized for how
2
many
days. Actually,
just 2 days?
Just 2 days. Actually, had a few of my co-workers who came and visited me the same night, and a special cousin, and she also came, and you know they were there, and my friend, and everybody was saying, "You sure you did surgery?" Because you laughing and smiling and said, and I said, "Yeah, I want to see." And they said, no.
So you were there for 2 days.
For 2
and
days.
Then you were allowed to return home, but you couldn't drive yourself.
No, I couldn't drive myself. I had to go back every morning for her to check the
change the bandages.
Change the bandages, and I had to give what amount of fluid came out because I had the tubes, you know, with the bag. So I had to, when emptying those, I have to let her know what amount so they know how long am I going to keep that in and everything. So I had to go.
I'm squeezing my hand
Monday,
so much
I had to go from Monday to Saturday.
Still. Yes.
And I think I did that for maybe 2 weeks, I think. And
but in the meantime, you're not able to take a shower, I imagine.
No, you had to do sponge because you couldn't get that area wet.
Yes.
So
the
you had to
moisture
do the
sponge.
for that area. The sponge. Couldn't do no strenuous
no
work.
Beach?
Couldn't go to the beach yet.
Because it's,
couldn't go to the beach yet.
Because you know in Antigua.
Right. I did ask about that. Can I go to the beach?
The
and
beach
she said
can
not.
heal.
She said no, it can't go to the beach yet until the bandage is taken off. And
so no shower, no driving, no
and
lifting
I remember
of heavy.
I was staying by Mom, I think the same night when I was discharged, and Mom was saying, let me help you, and you know. And I felt so sorry for Mom because, you know, my mom is up in age and she tried her best and she was helping. I said, you know, and I said, don't worry, because I was more worried about Mom because I didn't tell her initially. I told her when it was close to the surgery and when I got back the results.
So she must have been worried.
Because I didn't want to tell her until I did both biopsies.
Right.
You know, that's the
so you
promise.
don't have to return to tell her twice. Just
so me and my brother decided that we were only going to tell a few persons, you know, which I told more than.
I am so happy that nobody divulged the information to your mom.
I sort of kind of believe somebody did, but I just left it. I sort of kind of believe somebody did.
So you've taken us through the wound care and returning to the hospital and everything. Is the breast area fully healed now?
I wouldn't say it's fully. The area is still very numb.
Sensitive.
And very sensitive because I went through 6 months of chemo and 5 weeks, 5 days a week.
So you're not able to wear bras?
So not able to wear bra, yes.
Have you ever thought of breast reconstruction? Because some persons, they would have it done immediately following the removal of the breast, or they wait a few months, or sometimes even a few years after the mastectomy.
Well, for me, I have to let my body heal maybe a good 5 years before even thinking about that.
So you'll just use the bra and...
I'll use the bra and use the insert, and for now.
Okay. Throughout this entire experience, did you feel any depression at all, any emotional imbalance?
Of course, there were times when, even when I was at work and a couple of my co-workers caught me one day, I got up from my desk.
This is after the surgery?
This was during this year actually, during radiation.
Okay.
And I went in the kitchen and I started to cry. I was in there by myself, and then I called one of my coworkers. And she asked me what happened to me. And I said, girl, I don't even know. I just...
It was one of those days.
I'm just going through one of those days where, not that I'm blaming anybody, but I said to myself, I wonder if working down at the landfill had anything to do with it, or...
You were just retracing your steps.
I was just retracing because, and she even said to me, you know, she thought about that too, because she said, when you were at the head office, everything was going so good. And everything just broke down after you got down there to work.
But remember, you also have a family history.
And then I said, you know what? Let's not dwell on that. Let's not dwell on that. I'm alive. And let's move on from that. I'm not going to dwell on that because I don't want to go into a depressive state. And we just hugged and prayed a little bit, and then I went back to work just like nothing happened. But there were times, even when I'm at home, sometimes I'll say, oh boy, my body, sometimes, especially when I feel, sometimes there are days I feel logy, you know, and I will go to work, and I'm fine at work. Sometimes during the time I'm at work, you know, I feel logy because I was doing the chemo and I would still go to work the day after, and sometimes they say, what are you doing at work? I say, well, I'm going to stay home for I'm feeling all right. And then when radiation came up, I started radiation. I would drive myself to radiation, drive myself to work, because radiation wasn't for long. But then after...
Don't you think that you're trying to do too much by yourself?
I think eventually I was doing too much.
Overwhelming your body.
I was overwhelming my body because there was times I was feeling so... I had joint pains, and then all of those were from the chemo, you know, because I did my research as well too, you know, so I think I was pushing myself too much. And that's when the oncologist decided, okay, you need to take a break, okay? You're not no superwoman.
Exactly. Coming up in the next segment, we're going to talk a little bit about after surgery, where you are now, and your aspirations for the future. Because cancer, Dr. Yazigi told me, he's an oncologist, and he visited the Pauly show on a couple occasions, and he said to me, cancer is not a death sentence.
That's true, it's not a death sentence.
Yes. There were 6 months of chemotherapy, you said, and 5 weeks of radiation, 5 days per week.
Yes.
So at times you were doing both together?
No. Chemo was by itself.
6 months.
6 months.
And then following.
And then following radiation came like
sometime after.
About 3-4 months after.
Okay. Hair loss?
During the chemo, I think on my second dose, that's when I combed my hair one day and realized it was coming out. And I remember when I was at work the Friday, my coworker said to me, Tio, you know, your hair coming out. I said, don't worry, darling. You'll see a new hair the Monday morning. She said, what happened? What are you going to do? I said, I'm going to the barber. She said, but maybe not necessarily have to. I said, I am going to the barber. So what did you do over
the weekend? You took it all off?
So when I left work that Friday, I went to my barber, said, you just let's take off everything. He said, well, you're accustomed to have short hair, so I know it's going to come like nothing to you.
What are the effects you had?
And my fingernails got dark, my toenails got dark. And
they were softened because I know sometimes
they got softer.
Very soft.
And my skin itself got darker, which I knew all of that was going to happen because all of that was explained to me.
Yes.
And I did my research. And I said, this is something that I got to go through. Another person said, you don't want a wig? I remember even my sister in Texas said, you want me to send a wig for you? I said, no, dear. This is how I'm going to go, and who don't like to see me, too bad.
So you use your vitamins and
So
your
I
minerals.
did my vitamins
and your moisturizer.
and I moisturized. And of course, after I was able to take off that patch, this
the
thing,
back.
I went to the beach every morning,
Wow.
and that is what helps heal.
Therapy.
Yep, that was very, very
You were,
good.
you were able to swim now. I mean, you were able to move your hand now.
Yes, that helped me.
But you
and
still had to be cautious about lifting.
yes, had to
Yeah.
be cautious about lifting. You couldn't
good.
carry no weight in that hand. Sometimes I forget and put my bag on the hand. People say, you know. But the beach helped me a lot. The beach helped me a lot.
And
I used to
actually, you
go.
can take a shower now.
Yep. Oh, yes. I
Felt
could take
good,
a shower.
right?
I remember one time I called the surgeon and say, okay, what about the deodorant? She said, yeah, you can use deodorant. Because, you know, persons have this myth about you can't use deodorant. You have to use a certain type of deodorant.
Yes.
You know, there
I've
were
heard
different deodorants that I would use. Because, of course, you're not going to go around not having no deodorant.
Yes.
But what I
You have
just
to
did, I
control your
just did not go
perspiration.
on with strong smelling
Yes.
perfume and stuff like that.
What about the diets and the meal plans now? Because it's post-surgery and...
What I was told by both the surgeon and the oncologist is that they did not want me to lose any sort of weight.
Oh.
So I could not go on any diet. What they asked me to do is to cut my portions.
Okay.
Because I needed my strength for chemo. Because I remember I asked the question, but a lot of times, even when I saw people have cancer, different type of cancer, I see them so slim and stuff like that. And they said that's because they don't do what we told them to do.
Wow.
And I thank God that I listened to them. Because people say, oh, you know, you have to cut out the sugar and you have to stop eating the chicken and you have to stop. So I went and I says, am I supposed to stop eating all of it? He said, I never told you to stop eating
Just
anything.
reduce the portion.
Just reduce the portion because you need your weight. You need your strength for when you're going to do chemo.
Yes.
And I thank God that I listened to them. I listened to the whole oncology department, the staff, and I was able to go through. I had
a tough spot.
I would say, you know, having to have needles insert into your vein, because when I started, it was a every week thing, and you're there for 3-4 hours. And when I saw, actually they said to me, they never saw another patient like me that sit and watch and see everything is inserted, and I ask questions, what is this, what is that? And half of the time, I was even looking at other patients and said, oh, sis, come here, that patient there, she don't look like
So you're now
she's too...
diagnosing people?
I said,
I suppose because of all the research you've done.
Because there were there were times, you know, you were in there with other patients as well, you know, and I was always looking and saying, that person look like she's in a little pain or something. Call the doctor, and she's like, Theolinda, I'm telling you. And there were times persons who would have been starting for the very first time who were very scared, and they said, okay, this patient here, we needed to give her a little support. And I gave so much support to some persons.
Theolinda, even in your illness.
Yep.
You're
sitting
still
there
offering service.
Yep, and I would help them,
great.
take them to the bathroom and stuff, and I'm hooked up to my stuff too, you know. And we said, this is the bathroom. I said, do you want me to come and help you?
We're ending tonight's program. You're very optimistic post-surgery. You're full of life, and I suppose this is what the doctors admire about you, and just people in general.
I remember when I first went to the cancer center when I was doing my first radiation. I had my support group there. We prayed and everything. And I asked them, can they come in and see what's going on? And they said, yes, they can come, and we'll let them know when they can come back. Because it was only for 15 minutes. But I wasn't scared or anything like that. And my second day of going down, I sat with persons in the lobby. Didn't even know the people them, and said, don't worry, this is your first time. You're going to be all right. So every time I went to radiation, the technicians would say to me, Miss Charles, do you know Mr. So-and-so and Miss So-and-so said, Miss Charles told us now, don't worry, everything is going to be all right.
Very good.
So I told them I'm going to be the next face of Cancer Center. So I have,
Super.
so I, you know, and they even
Super.
said to me on my last day, I forgot to bring my certificate. I even got a certificate for completing 5 weeks of radiation. And they said to me, you have to come back and see us. And I said, yes, I'm not only going to come back just for my appointment, but I'm going to come back. Actually owe them a photo shoot.
So what I'm taking away tonight is that optimism is important.
Yes.
Do your research online, speak with your primary care physician, speak with your medical team.
Yes.
Don't be afraid to
Nope,
ask
you have
questions.
to be positive all the
You
way.
have to ask questions.
Yep.
Don't be
Don't
left
be
in the
afraid.
dark.
Don't be afraid.
And a little openness about your illness can help you
Yes.
by expressing yourself
And help you to
and
survive.
also help you to survive and also to help
Help
other
others.
persons.
'Cause
Yeah?
that's my intention, to be a sports person for cancer. Any type of cancer.
And of course, you prayed a lot.
Oh yes, I must say. I had my church family, can't forget them, my church family at the Otters Wesleyan Holiness Church.
We want to thank you very much for sharing your
You're welcome.
experience with us. Before we go though, you are the cancer survivor. You're the breast cancer survivor. You're looking at the camera. What message do you want to leave with our young females and our older females about taking care of themselves so that they do not have to become a casualty of any type of cancer, but specifically we're talking about breast cancer?
Do like what I did around your birthday. Schedule your checkups with your primary caregiver. If you're even below 40, still go, and he or she will give you the advice, well, you may have history or something. Don't neglect it. Don't hide it, because some persons find out and they hide it. Don't do it, because breast cancer or any cancer is not a death sentence, and your life is very important. Do not put beauty in front of your life. Your life is very, very important.
All right, well said. Thank you for staying with us on the Paula Show. It was a very, very inspiring conversation with Miss Theolinda Charles, a breast cancer survivor. I hope that tonight you have been motivated to ensure that your pap smear is done, and especially that your mammogram is annually done.
Did you know surgery is one of the primary methods of diagnosing and treating breast cancer? Your first thought is probably a mastectomy, but there are several other types that you may experience. A biopsy is the first surgery you'll have. Using a needle, or sometimes scalpel, a sample of cells is taken and sent to a pathologist for examination. Needing a biopsy does not mean you have breast cancer. In fact, the majority of biopsy results show no cancerous cells. If the tumor is confirmed as cancerous, there are a few surgery options. A lumpectomy is the first. This breast-conserving surgery removes the tumor and a portion of the surrounding breast tissue. The amount of tissue removed depends on the size of the tumor and how far it has spread. After a lumpectomy, it's common to undergo several weeks of radiation therapy. The second option is a mastectomy. In this surgery, the cancer is extracted by removing the entire breast. Depending on the extent of the cancer, the nearby lymph nodes and underlying muscles may be removed as well. Sometimes a mastectomy can be performed without removing the nipple and areola. This is called a nipple-sparing mastectomy. Mastectomies are often the best treatment for advanced staged breast cancer. However, if the cancer has spread to the lymph nodes, radiation therapy may also be recommended. Some people may also choose to replace the missing breast after mastectomy. This type of reconstructive surgery is a personal decision and may not be right for everyone.